Coming up next on Being Well, our topic is cardiac rehabilitation. Lori Richardson, an exercise physiologist from Sarah Bush Lincoln Health System, will be in the studio to answer some of the most common questions about cardiac rehab. We'll be talking about who can benefit from it, what's involved, and what to expect. That's all just ahead, so don't go away. Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Additional funding by Jazzercise of Charleston. Thanks for tuning in to Being Well. I'm Lori Casey, and I'm joined by Lori Richardson. So it's the Lori and Lori show today. We're talking about cardiac rehab. Lori, tell us a little bit about what you do out at Sarah Bush Lincoln.
Sure. I am an exercise physiologist, and I work with patients that have had either a heart attack, bypass, stents, valves repaired or replaced, and help them to get their heart stronger, get their heart to start, and then to start being able to do more, increase their functional capacity, get back to daily living skills that they may have not been able to do overall.
So let's run through, you have a heart incident and then you're prescribed by your doctor cardiac rehabilitation. So what does that involve?
The way we run our program is they come into initial orientation, and at that time we sit down with them, we kind of tell them about the program, what they can expect from us, and then kind of talk to them about what happened, to have them walk us through it. A lot of times, you know, I don't know of anybody that wakes up one morning and says, I think I'm going to have a heart attack today. So most of the time it catches them by surprise. So it's letting them get a chance to talk about it, to say, here's what happened to me. You know, even the strongest person can have some fear, and it's getting those fears over with. A lot of times they're afraid that any type of exertion is going to get them to have another heart attack, or it's going to bring on the chest pain that they had or whatever it was. So we usually meet with them one-on-one for about an hour ahead of time, explain the program, get some history, get them set up in a class, and they start off.
So so it's just not people who've had a heart attack that go through cardiac rehab. What kind of heart incidents or ailments do people have that lead them to cardiac rehab?
You can have a stent or bypass without having a heart attack, valves that have needed to be repaired or replaced, and now we've got Medicare has approved congestive heart failure patients. Unfortunately, the guidelines for congestive heart failure are a little bit more stringent, so those are something fairly new to us, but those are the primary diagnoses that people will come in and be able to have insurance cover. Now we have some patients that come that don't have insurance, and we usually work something out to where we can help them out without having to worry about that.
So how does that benefit a patient to go through the cardiac rehab process after they've been through their surgery or procedure?
I think one of the biggest benefits is just giving them and their loved ones a sense or a peace of mind, knowing that they are slowly getting brought back into doing the things that they used to do, but they still have somebody there that knows what they're doing and knows how to pace them with their activity. The other thing that I think is really important is it becomes a social network for them and a support system. A lot of times you'll have, and it doesn't matter whether it's female or male, very active people that this has come completely out of nowhere for them. They feel like one minute they woke up and they were healthy, and the next minute they're unhealthy. And it's getting them to understand that they're not alone, that there are so many other people out there that have had the same problem. And it's kind of nice because we get to have a mixture of people that have recent health problems and people that have been with us for many years in the same class. And I think that's very beneficial for many reasons, but one of the biggest ones is so that they can see, look, he started where I did, and he's been here X amount of years, and he's still going strong. I have hope that I can get back up to that.
So what are some of the typical feelings or symptom signs that people have once they've, say if you had a stent put in and you're back out of the hospital? Are people tired? Do they feel lethargic?
not feel like
Usually,
exercising?
Actually, with heart disease in particular, for the most part, there's a spontaneous recovery because a lot of times they don't even recognize the signs and symptoms of heart problems until after the procedure has been done or after they've had something done, and they'll say, well, I used to have indigestion, but as soon as I had my stent or my bypass, that indigestion went away. Well, it wasn't indigestion. It was angina. It was chest pain. So a lot of the times when they come back, they feel much better. Occasionally you'll have people, depending on their age and their overall health status, that it just really took a toll out of them, the whole experience. So they will be a little bit more tired, more fatigued. Sometimes their muscles are extremely weak, and so the biggest problem for them is just building up the muscles in the legs and getting them able to do more. The biggest joy for me is watching somebody come in the first day when I'm doing an orientation and point to the treadmill and say, I can't do that. And I'll ask them why, and they'll say, because I can't, I just get too short of breath. To see them progress throughout and be able to do the whole rotation or the whole time they're there on a treadmill is, to me, a huge great thing, because they get to see how far they've come.
So do you have a lot of patients that have never done any type of formal exercise, gym workout?
Yes.
That this is kind of their first experience with that?
Yes, very much so. The older generation especially, it just, they did a lot on the farm, or growing up, their jobs around the farm or around the house was a lot of things that they did, and so that was their physical exertion. So to actually say to them, do you exercise every day? Well, I do the dishes, I do the laundry, I go up and downstairs, and I say, well, that's great physical activity, but we're talking regular exercise, and it is a new concept, very new concept for some of them. We're getting younger and younger people into our cardiac rehab, and you would think that they would understand a little bit more about the need for exercise, but it's across many generations.
So is cardiac rehab required, or is it optional?
It is absolutely optional.
Okay.
The doctors can say very strongly to their patient, I want you to do this, but it is ultimately the patient's decision. We can't force them to do it. We can encourage them to do it. And there have been many times where we've had patients that are really against it, but they say, well, I have to do it because of the doctor. And I will usually stop the orientation and say, you know what? Part of this, the benefit of this is that you'll get out of it what you put into it. And if you're not willing to put it into it, we can teach you all you want and have you doing the exercises, but you're really not getting out of it what you could get out of it.
So if someone chooses, they say, I don't want to do it, does that slow their recovery down?
Yes. In my opinion, yes, it does. Because from my experience with patients like that, a lot of them, they're not going to do anything on their own. So they are just sitting and doing nothing at home. And there is many research studies that have shown that physical inactivity is a huge risk factor for not only heart disease, but stroke and for vascular disease.
So their chances of maybe ending up back in the hospital with
Yes.
something else probably increase.
Very much so.
So run us through, once you've done that orientation, what is the length of a typical cardiac rehab program? And what do people do when they get there?
Sure. The Medicare guidelines state 36 sessions or 18 weeks.
Okay.
Most insurance companies won't go above what Medicare says unless they have another event during that time frame, and then they'll usually tack on time. So the first day that they arrive to exercise, not for their orientation, but the first day of class where they exercise kind of starts their countdown. They have 36 sessions or 18 weeks. If they have another insurance other than Medicare, we take care of calling that insurance company to find out what they're covered for so that the patient has no surprises. We've seen some insurance companies that will cover 20 sessions, 24 sessions, but the maximum is about 36 sessions. Once they've started, they come in. Each class lasts, you're in and out within an hour. They come in, we give everybody a blood pressure before they exercise and after they exercise. The ones that have had something recently done, they wear a heart monitor throughout the whole time, so we can see what the stress of exercise does to them. They do about 3 different rotations on the equipment for about 12-13 minutes. We do an education. We have a very captive audience, so we take that time to not only talk about the different procedures that get done, but all of the things that lead up to the blockages. It's amazing how people still truly don't understand that the lifestyle that they've led and the choices they make every day truly affects our physical health. And so we spend a lot of time talking about that as well. Not just the dietary aspects of it, but why physical activity, why exercise.
So this is a lot more than just going to a gym and hopping on a
Yes.
treadmill for a half
Yes.
hour. There's close supervision
Yes.
with monitors and
Yeah.
things like
And
that.
that is the one thing that I have a lot of people ask me is, well, why do I need to come to you if I can just go to my gym that I already pay membership to? And I tell them, exercise-wise, equipment-wise, you probably will get the same thing. But what I really feel like you need, at least initially, is some of the education behind why you should be exercising, what limits, how hard to push yourself or when to increase. Those are the things that we encourage them to do. And then when they graduate our phase 2 program, which is the monitor program, then I feel comfortable sending them out and going to a gym if they don't want to continue on with us.
Do you find a lot of patients, maybe it was someone who never went to a gym, never did any formal exercise activity, they have a cardiac incident, they come to you, do they keep that up after they're done with your program?
I would say most of them that leave us, probably not. I think they have great intentions, and I really do think that they truly feel that they will, but then life happens. One of the other benefits, I think, of coming to our program or to a cardiac rehab program is the accountability. Again, I can't speak for other programs, but I know our program, if we haven't seen the whites of your eyes for a while, you get a phone call from us and say, hey, are you doing okay? What's going on? And you'd be surprised at how many of them that sparks them getting back in, because they realized, hey, I'm not just another number. I'm somebody that they've missed. We give a little leeway depending on the person. If we know they travel a lot, if we haven't seen them in a couple of weeks, then we get a hold of them. If we haven't seen somebody that's normally very regular and they haven't come for a couple of days without calling us to tell us, we're usually on the phone trying to figure out what's going on and make sure they're okay.
And does it become kind of a social activity for some of your patients?
Absolutely. Yes, absolutely. It's a very fun environment. I mean, we really encourage the camaraderie, we encourage all of that, because again, it's a support system, and we have several people that have said when they've continued to come that, without this program, I don't know what we would have done. I wouldn't be as active. I wouldn't be able to do this. I wouldn't be able to go on my vacations. I wouldn't be able to be active with my grandkids. So a lot of it is also their doing. We can't make them come, but we're glad that we're there and they enjoy coming enough that they will come on a regular basis.
Now, you've worked with patients, you said, for 14 years. I'm sure in that time you've experienced several of them who go through that kind of sort of depression phase. Can you talk about where that kind of comes from? And if someone maybe is watching, is struggling with that after a cardiac incident, they kind of feel a little down and depressed.
Sure. One of the things that I really like to explain to all of our patients coming in, one of the questions we ask them during the orientation is, are you struggling with any problems with depression or anxiety? And sometimes you have to coax that out, but a lot of times that's their opening to actually start talking with you. And it is extremely, extremely normal to go through a little bit of depression and anxiety when you have anything that is shocking to you, whether it is a heart attack or bypass, or whether it's a appendicitis or something. I think a lot of us get to the point, especially when we feel good, we're indestructible. We may not use those words, but we think, well, I'm doing great. I'm soaring through. I'm feeling fine. And then in their opinion, wham, they've been hit out of nowhere. So it's very normal to go through that sense of, oh my, now I've aged 10 years. And so anything that is major like that can cause it. And I think, again, one of the big benefits of coming to the program is first to show them you're not alone, not only in your physical health, but in your mental health. Here's where you need to come out. Feel like you're okay here. Sometimes we have people that have all these health problems, but they're also caregivers to other people. And so this is just one more burden to add on to them. And one of the things that we talk about is stress management in our classes. And we talk a lot about, you have two ways of looking at the rehab gym. As soon as you walk in that door, you leave all of your problems outside. You're going to have to pick them up when you go out, but that gives you your hour to be who you want to be in here, to not worry about it. Or this is your hour to come in, and you've got great listeners here. We're all here to help you, and we've got several people that have come in and they'll start talking and it leads to another, and that's what the discussion is, and by the time they leave they feel much better knowing that they aren't alone in this situation. So it's very, very normal. One of the things that we usually tell them is, do you feel like you need to talk to somebody? We're happy to make referrals or call their primary doctor and say, hey, just so you know, here's what's going on, what do we need to do? So we're kind of the go-between sometimes between the doctors and the patient, so that we can maybe get issues taken care of that maybe they just failed to mention to the doctor when they were in there before.
I know every case is different, but I'm sure you get this a lot. People say, Lori, when can I get back to my regular life activities? When can I get back to doing the things that I used to do prior to this?
Well, that's a very good question, because we do get asked that a lot. It really depends a lot about their overall health. And I hate to use the word, well, if you just had a heart attack, I don't mean it to sound as dismissal as that, but we have some people that, for the most part, when you look at them and you look at their history, they're pretty healthy. And so most of them can bounce back pretty quickly and get back to the normal activities. We have others that have multiple health issues, and one thing after another leads them up to that. We basically tell people, you have to realize that certain activities, it may be harder and longer to get back to. For instance, a lot of men in the wintertime like to go shovel snow. Well, one of the things that we tell them is, unfortunately, shoveling snow needs to be out. Because of the extreme cold with the heavy lifting and not breathing right, you can actually end up having another heart attack. Same thing with the extreme heat. Things that used to feel somewhat easy to them, their body has just maybe not has been compensating all these years, and now it's just like, So we always tell them, you need to listen to your body, no matter how fit or unhealthy you are. If your body is saying to you, not okay, extreme short of breath, chest pain. One of the common questions that we get a lot is, when can we return back to intimacy? And that is a hard topic for a lot of them to talk about. And I have to laugh, because when I started in the program, I was only my early 20s, and to have some of these patients, there was no way they were going to talk about that with me, especially with that generation. And it was embarrassing. I had several class members that used to try to do everything in their power to make my face turn red. But it is a very big concern.
It's a valid question.
It is a very valid question, because the person that had the incident happen to them, they know how well they feel. They feel like, hey, I'm ready to get back into doing everything I used to do, but they're not thinking about what their loved ones watched. They're not watching, they didn't see them get loaded into an ambulance. They didn't see them get taken into the surgery room. They didn't see them with all the tubes coming out of them. And the only thing that they can see is, I don't want to touch them. I'm afraid they'll cause another heart attack. So the biggest thing that we tell them with anything is communication. You have to start communicating with your loved ones to say, okay, I think this is where I'm leading. Are you okay with that? The general rule of thumb, though, with that is, we always tell people, if you can go up two full flights of stairs without getting the chest pain, any of the signs and symptoms of heart problems, then you are physically ready to return back to that. But a funny story with that is, I have to always tell people, go up the stairs facing forward, not backwards. We had a gentleman that was still getting chest pain early on in his life and went up backwards, and you don't get the chest pain because it's not as hard going up backwards. So it's going up the stairs facing forward 2 flights, and then they're safe to return.
Okay. I'm going to give you an opportunity here to talk about one big misconception that you think people have about heart disease or heart health, that you have this platform right here to get that up, because I'm sure in your line of work, you probably hear all sorts of things.
I do. There are a couple, there are many, but one of the ones that I think is hard for people to understand is that there are many forms of heart disease. People think that as long as they didn't have a heart attack, they don't have heart disease. Well, heart disease encompasses many things. A heart attack is one of them. Stents, bypass, valvular disease, and congestive heart failure. Those are all considered heart disease. So even if you've never had a heart attack or a stent or a bypass, but you had a valve repaired or replaced, that is a form of heart disease. So that's a big misconception that a lot of people have. And yes, you still need to make sure that you follow the same guidelines, healthy lifestyle, your choices that you make, not smoking, exercising, eating right. All of those things pertain to all forms of heart disease, even the vascular disease.
Let's talk a little bit about, in your area, exercise and heart health seem to go hand in hand. So I like to end each show with some prevention. What are some things that we can do now to help in terms of exercise and heart health? What should we be doing now?
Okay. Obviously, being an exercise physiologist, exercise, exercise, exercise. I always joke that there is no wrong answer when you say exercise is for everything. One of the things with exercise is it is what I call a dose response. Your body learns to adapt to whatever you do. Once it's adapted to that, it will continue to stay at that level, but you'll never get any more benefits from it. So even in the cardiac rehab setting, we progress patients. Once they have adjusted to their workload, once they have kind of stayed there, heart rate, blood pressure are normal, we start to gradually increase the intensity of their exercise. So not just exercising, but making sure that you understand the right level and intensity, and making sure that you're constantly trying to progress to get better and better with your exercise. Whether that's distance or whether that's time or whether that's intensity. And also eating. We always talk about every show has some type of eating in it, and there really is going back to the basics. Yes, you can have red meat. Yes, you can have the things that you like. The old adage, spit it out if it tastes good, is really not true. You can have everything, and moderation is the key. But I think some people's definition of moderation is the problem.
Yes.
So
let's talk, I want to go back to, you said earlier, exercise is progressive. So it's great that someone maybe walks every day after work for 45 minutes. But are you saying that after so many years of doing that's the benefit of that is not what it was initially?
Right. You're no longer getting anything more from that. Your body has adapted to that. You're not hurting anything. You're absolutely maintaining the level of fitness that you've gained when you started that. But once your body has adjusted to that, it needs to have some other stimulus to increase. It's very similar to me taking a dumbbell and putting it in my arm, or putting it in somebody's hand and say, okay, I want you to do 10 reps with this, and we do that for a little while, and as soon as they do well with that, I keep increasing the weight. They're going to notice an increase in strength in some cases, some increase in size, and some of the way it looks. You have to think of the heart and the aerobic exercise as strength training for the heart. If you don't continually challenge it and increase the stimulus, it isn't going to get stronger. It's not going to get any better. So we have to think about that in the terms of dose. Again, you can increase it by that same person that has walked 2 blocks or 3 blocks or 3 miles for years. They're not hurting themselves. They're just not going to get any better. What they need to do is either increase their speed at their walking, or go farther, or go more days a week. So there's many ways to improve upon that. But that's kind of what you have to do, and you have to learn. Unfortunately, I think women are the worst at this. We get very comfortable.
Yes, we like our exercise class that we've gone to forever, or a walking route or running route.
And there's no change. I know what I'm doing.
I know the routine.
And that's a hard one. Guys are usually on the other end of it. They usually go out way too hard, way too quick, and then end up getting injured, and then they have to go backwards. And then as soon as they heal, they want to go all as hard as they can. So there's a happy medium in there that I think a lot of people have to remember, that again, it is progressive.
So if you are a walker, so what should your happy medium? It shouldn't be like, oh, but it shouldn't be you're gasping for air. So how would someone could visualize how hard should they be working?
One of the things that we tell our patients, and this goes for, it doesn't matter whether you're healthy or an unhealthy person, if you can sing, even though I'm a horrible singer, but if you think about, if I can sit here and talk with you like this, if I can sing a song while I'm doing my exercise, it is not intense enough to get the benefit.
Okay.
On the other hand of that, if I'm absolutely gasping for breath and I can barely say a yes or a no, the intensity is too high. Now, there's all kinds of forms of exercise, so I'm not going to say to you that there aren't some people that can benefit from the high intensity exercise, because there are. But for the cardiac section of patients that we're talking about, we don't want them in that level, because A, they're not going to be able to keep it up, and B, they're not going to want to come back and do it again. So the happy medium is that it needs to feel challenging but not hard. It's okay to be a little bit breathless. It's okay to be a little bit perspire or sweat just a little bit, but not to the point where you can honestly say, I just can't keep this up. If you can say, I could do this all day long, not hard enough. If you say, I can't keep this up but a minute or two, it's too hard. You should be able to pick a pace that keeps you going, that you feel a little bit breathless, for about 15, 20 minutes or more. If you can do that, then that's a good intensity. And over time, whatever you've been doing will become easier and easier and easier. And that's when you need to know. But that's a hard part, because it's comfortable. It's taking you out of your comfort zone.
That's right. Well, Lori, our time has gone by so fast. So I want to thank you for coming back to Being Well. Lori was actually, we started this show like 4 years ago, and you were one of the guests in the first set. So she's come back and again provided us with great information. Thank you.
You're welcome. Thank you for having me.
Hot dogs, hamburgers, chips, and potato salad. Those are the fixings for a fantastic picnic.
The problem is this menu is loaded with sodium, which can be bad for your health, especially if you have heart disease. Mayo Clinic experts have tips on how to enjoy these foods without consuming too much sodium.
On and after the 4th of July holiday, emergency departments like this one at Mayo Clinic beef up their staff, not just to prepare for firework injuries, but to care for people who get into trouble because they ate too much sodium at holiday picnics.
The ones that are truly at risk are the ones that have heart disease, meaning their heart doesn't pump well, people with heart failure.
Dr. Stephen Kopetsky says sodium raises blood pressure. Here's how. Your arteries are like this hose. Pressure is determined by how much water flows through it. If there's a lot of extra sodium in your system, then there's extra fluid in your blood, which raises the pressure in your arteries.
Can tip you into a heart attack and can tip you certainly into heart failure, where your heart fails to meet the body's demands, can't pump enough fluid, so you get very short of breath.
So what can you eat at that cookout?
I really do not believe in denying oneself.
Dr. Kopetsky says just be smart about it. First, eat small portions, maybe half a hot dog instead of a whole one.
So if you eat a hot dog with the bun, a little bit of ketchup, a little bit of mustard, that's easily 1,100 milligrams of sodium.
And the daily intake for someone with heart issues should be 1,500 milligrams. For those without heart issues, 2,200 milligrams. Second, fill up on fruit and veggies. And third, beware of hidden sources of sodium, such as soft drinks, processed foods, canned goods, cheese, meats, sausage, and breads.
If you go to a hamburger store and you get a hamburger and french fries, there is likelihood more sodium in the bread of the hamburger than there is in the french fries.
Check labels of the types of foods you'll eat beforehand so you're aware of where the sodium's hiding. So sure, take a few bites of Grandma's famous homemade coleslaw you've been craving all season. Just pay attention to what and how much you're eating. For Mayo Clinic News Network, I'm Vivian Williams.
Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Additional funding by Jazzercise of Charleston.